Let's not overlook.
All right, I got 6:31 to call this meeting to order. Clerk, could you please call the roll?
Howard, Esri,
Here.
Furtado,
Here.
Goss, Harper,
Here.
King,
Here.
Lokshin,
Here.
McGuire,
Here.
Michaels,
Here.
Passalacqua,
Here.
Paul,
Here.
Rodriguez,
Here.
Store,
Here.
Straub,
Here.
Summers,
Present.
Taylor,
Here.
Thorsland,
Here.
Vanek Theranot, Williams,
Here.
Wolken,
Here.
Carter,
Here.
Patterson.
Here. All right, could I have a motion for the approval of the agenda?
So moved, Michaels.
Second? Anybody?
Second, Carter.
Right, Michaels and Carter. Is there any discussion, additions? All right, seeing none. Clerk, could you please call the roll?
Esri,
Yes.
Furtado.
Yes.
Has Goss joined the meeting? Not yet. Harper?
Yes, and Jim Goss is out of town.
Okay, thank you. King,
Yes.
Lakshan,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland.
Yes.
Has Vanek Theranot joined the meeting? I don't see her yet either.
I'm
Williams? Oh, there you are. Thank you.
Yep.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes. All right, could I have a motion for the approval of the minutes from the December 8th, 2021 regular meeting?
So move, Thorsland.
Second. Summers.
Summers.
All right, Thorsland and Summers. Is there any discussion, any edits? All right, seeing none, clerk, could you please call the roll?
Esri,
Yes.
Furtado,
Yes.
Harper,
Yes,
King,
Yes.
Lakshan,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland.
Yes.
Vanek Theranot,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes. All right, next on the agenda is public participation. Any members of the public, just raise your hand and call on you. Let's see. Alan Axelrod.
Thank you. Can you hear me?
Yes.
Awesome. So I want to start out by thanking County Board Member Jacob Paul for working near 3 months for getting a resolution on the agenda tonight regarding utility shutoffs and the pandemic safety risk that this poses. As campaign lead of No Ameren Shutoffs, where we have been operating for 18 months, we have worked diligently to aggregate data regarding the health risk posed by utility shutoffs in collaboration with multiple counties' public health districts, with news media, including the Washington Post and The Intercept. And we have had conversations with electeds concerning the constraints that they face during this pandemic. I'll start with a conversation that I had with Kyle when we were first talking about the utility shutoffs resolution in the Champaign County Democratic Party in 2020. The county board chair rightfully expressed the concern for working people, saying that they aren't going to be able to save up money to address the accumulated utility debt. That is a concern that has been a focus of this campaign, where we advocate for the implementation of state protections and the appropriation of federal funds. We have done that. We have done that through the resolutions that we passed all through 2021, which resulted in the creation of the Utility Disconnection Avoidance Program that appropriated at first $80 million to 80,000 households. Then, as we continued to pass resolutions, was expanded to $115 million to 115,000 households. Ultimately, it was $112 million distributed to 121,000 households. Unlike protections that we have, such as the Low-Income Home Energy Assistance Program, the Utility Disconnection Avoidance Program was automatic, which meant that vulnerable, exhausted households were able to get desperately needed support. Full stop. And what we saw was 2 weeks after the implementation of the Utility Disconnection Avoidance Program, our coronavirus caseloads decreased. 2 weeks after the cessation of the Utility Disconnection Avoidance Program, our caseloads increased again. I'm also reminded of the eviction open letter concerning the pandemic health safety risk that it posed. I want to thank county board members Mary King, Leah Taylor, Chris Storr, as well as Kyle Patterson again, and Stephanie Furtado and Eric Thorsland. Thank you all for signing that open letter noting the pandemic safety risk posed by the loss of housing. One of the things that people have struggled to understand is that utility shutoffs proceed faster than evictions by an order of magnitude. Since July, we have had over 200,000 households, utilities disconnected. That's over 500,000 people based on the average household size of 2.54. This is the extent of the problem that we are facing. The resolution before you tonight calls for the governor to implement statewide protections and calls for Congress to pass a piece of legislation that would appropriate funds to utilities as well as the sanitary district. Please use your privileged positions as our representatives to protect our most vulnerable people, because this is the historic zenith of the pandemic. And it's only the first time this week that the statistical samples provided by the Illinois Department of Health showed more Omicron cases than Delta cases by a significant margin. It's only the second time that we've had more Omicron cases than Delta cases, according to their statistical samples ever. We are only just seeing the beginning of this spike. Please act. Thank you.
All right, next we have Tyler, and you can unmute now.
Hello, can you hear me?
Yes.
Excellent. So my name is Tyler Gegg. I grew up in Mahomet, and I currently live in Urbana. I also wanted to express my support for the resolution before you today, because I feel like now, just as we have done for the last 2 years, we have to do everything we can to help out the most disadvantaged during this pandemic, both for our sakes and for the sake of public health. Throughout the last 2 years, I've felt continually frustrated by how little I could do to help my neighbors during this time of crisis. I've tried to keep myself and my loved ones safe as much as possible, and in particular because several of those loved ones were at greater risk for complications with COVID because they had asthma or other breathing conditions. And I was terrified when, back in the summer before vaccines became available, my mother caught COVID because, well, not just because I was caring about her health, but also because I worried if her condition became severe, I wouldn't be able to visit her. I wouldn't be able to help her in any other way than just, I guess, throwing money at her or dropping something off at her doorstep, because I would put other people in my family at risk if I got anywhere close to her. And the good news is that my personal experience was both very privileged and very fortunate. My mother had ended up, after a couple of days of it being kind of bad, had a mild case. She never ended up going to the hospital. She had access to early testing. She had the medical care she needed. She had insurance. She had housing. She had the ability to pay for it. She could leave her job for a couple of days. And, well, it ended up being 2 weeks, but, well, 3 weeks. She was able to leave her job for a long amount of time. And if any of those pieces, any of those bits of fortune had been removed, we would have been in a really bad position. We would have been in a really bad place, and I would not have been able to take care of her. You see, because my mother was in a public service job. She was working at a cafe. And because of that, she had no choice. She either had to be working and potentially getting other people sick, or she had to stay home. And if she didn't have all of those other pieces together, she was risking her own livelihood and the chance that she would have no choice but to go into an extremely crowded hospital. As she was also, the timing was pretty lucky because it was still in a period of the pandemic where we had all the sympathy and support for essential workers. Everybody, it was the buzzword, it was on everyone's mind. And so now, as we're entering the third year of the pandemic, when I heard about this resolution coming before you, I had to come by and speak up because things haven't returned to normal. And it's really hard for me personally to hear about that sympathy and support for both essential workers and for our disadvantaged. There's a lot more talk about if you're getting COVID at this point, then just deal with it because you shouldn't be getting it. And yet, once again, my family, several members of it, have caught COVID in the last few weeks because of the Omicron variant being so much more easy to spread. It's, well, again, I have been relying on the good fortune and privilege of my current situation and my family situation that no one has gotten very sick. No one has needed to, no one's had to lose any pay. We've been very lucky. And I know there are a lot of other people who don't have that luck. They don't have that luxury. And I should not need to have a personal experience with this disease to have support for people who could get sick, but it certainly helps. If my mother had to continue working to keep her lights on and her heat going, I don't know how that would go. And I've been very, very grateful for living in this state and knowing that there has been this protection for people in case this protection for people and for their utilities in the event that they were unable to pay due to the pandemic. There's very little I can do for my community during this time, but as members of this, as with the positions you guys have, I would hope that you would continue to be leaders on this, to be voices to try and continue giving that support. I don't want to remove these pillars from anybody else so that nobody else has to get sick. No one has to get sick and worry so much about how they're going to stay healthy and keep their community healthy. Thank you for your time.
Thank you. Next, we have Brandy McCoy. And you can unmute yourself now.
Hi, my name is Brandy McCoy. I am an Urbana resident, but I go to school at Parkland in Champaign. I'd like to speak in favor of the resolution being considered tonight regarding utility shutoffs as a pandemic safety risk. The governor has failed to enact statewide mandatory measures to ensure utility companies put people over profits. Water is a basic need at any given time, but especially during a pandemic. This is just a fact. I urge the board to pass this resolution to ensure that people are protected with their utilities and to continue to advocate for public and pandemic safety. Your constituents look to you for your advocacy and your protection while corporations run amok during this pandemic and continue to as the pandemic goes on and on. Please do the right thing and pass this resolution. Thank you.
Thank you. Next, we have Fiona. You should be able to unmute now.
Thank you. Can you hear me?
Yes.
Fabulous. Good evening, board members. Thank you for this opportunity to speak. My name is Fiona Monroe. I'm an Urbana resident. I am also here to speak in support of the resolution declaring continued utility disconnections in Illinois to be a pandemic safety risk. I'm speaking out of concern for those whose housing and safety will be compromised by utility shutoffs during these winter months. Personally, I believe that no one should be without heat in the winter for any reason. But that aside, I know you are aware that COVID cases in the county are rising. Having more folks able to isolate in their own spaces without fear of losing heat, water, or light can only assist the efforts to reduce those numbers. You're probably also aware that Urbana Middle School is doing virtual learning for at least a week. Due to COVID, those students, of course, cannot learn without electricity, but I also think that that situation should serve to indicate the severity of the pandemic here currently. I strongly encourage you to pass this resolution and to put pressure on the governor to suspend utility shutoffs again. Thank you.
Thank you. Next, we have Grace Wilkin.
Hi, can you hear me?
Yes.
Thank you. My name is Grace Wilkin. I am on the Urbana City Council. I'm speaking as a member of the public from the county. Just wanted to quickly speak in support of your resolution declaring utility shutoffs in a pandemic a public safety risk. Our COVID cases are continuing to go up higher than they've ever been. Utilities are essential, and especially in the pandemic and in winter. I don't know of any negative impacts when Urbana passed 2 resolutions similar to this one before you tonight. So I see no reason not to vote yes. And I thank you for your time and service to the county.
Thank you. All right, next we have Stuart Levy.
Hi, let's see. Yes, I'm Stuart Levy. I live in Southwest Champaign. I too would like to speak in support of the resolution about utilities disconnections and recognizing, well, let's see, I guess we should recognize that during the first year or so of this, there were a lot of government supports, both from the state and the federal government, and most of those have now expired. But if you look at the statistics in, how many teachers are out of school because they're sick, or how many children are, how many hospital beds are occupied, the pandemic is still very much with us. And anything that we can do, that our government can do in order to support the lives of the citizens, support the lives of our citizens, is very appropriate. The resolution, of course, doesn't directly call for expenditure of county money, but it just says that the county hopes that our state and our federal government will do what they can to support the lives of our people. If the Maintaining Access to Essential Services Act passes, it would even the utilities that are that would be providing the services for some period of time without payment, even their losses would be covered. So I hope this is easy to support, and I hope you will indeed support it. Thank you.
Thank you. Next, we have Rachel Harrison.
Hi, can everyone hear me?
Yes.
Okay, thank you. My name is Rachel. I'm a resident of Urbana, and I'm also here in support of the resolution declaring utility shutoffs in Illinois to be a pandemic safety risk. Illinois is currently experiencing our highest ever COVID-19 case rate, meaning that more people than ever are having to self-isolate due to infection or exposure. A moratorium on utility shutoffs would allow more people to safely quarantine at home. The current conditions of the pandemic make a moratorium on utility shutoffs necessary for the health and safety of our community, and I urge the board to adopt this resolution. Thank you.
Thank you. Next, we have Eddie Pratt Jr.
Hi, can you hear me clear?
Yes.
Great, great. I would like to thank you all for giving me the opportunity to speak before you tonight. Well, virtually. I hope all is well with you all in the new year and that you are safe and relatively sound. I speak tonight as an essential worker or otherwise frontline worker here in CU, just someone that just working a job, right? You know, the people that they were calling everyday heroes around this time last year. I work with people who are exposed to COVID at upwards to 100 times an hour. These people are also racially identifying in large part as a minority. So there is an intersectionality between utility shutoffs and who is actually getting shut off and who isn't, racially. So this resolution, which I'm calling in to support, I believe is also one of racial equity as far as making sure that those who are most vulnerable, which within this county and system and throughout all these stats show it is poor, Black and brown, and others who are more subject to having their utility shut off and that leading to an eviction, being unhoused in the middle of a pandemic. It's a worst case scenario for a lot of folks. And we know now that popular work policies do not allow people to follow best practice in avoiding contact with COVID. And so, because we don't have these things in place, we need you tonight. We need you to be good neighbors to us all and vote in favor of this resolution. It's my hope that you will do so. Thank you.
Thank you. Next, Kai.
Okay, great. Can you hear me?
Yes.
Great. Yeah, so I'll just keep my comments short here. I'm calling in support of the resolution that everyone else has talked about. I've lived in Urbana now for going on 5 years. And this is the first time I've felt so moved as to call in support of a resolution. And that's just to say that this resolution really matters a lot to a lot of people. And to me, it seems like there's no question everyone on the board ought to support it. And that's all I called in to say. Thanks a lot.
Thank you. Alex Taylor.
Hi, can you hear me?
Yes.
All right, cool. My name's Alex. I'm a PhD student at the University of Illinois, and I currently live in Champaign. I want to express my support for the resolution on the agenda declaring continued utility disconnections in Illinois to be a pandemic safety risk. I fully support this resolution because water and electricity shutoffs significantly undermine our ability to stay safe during the current public health emergency caused by the COVID-19 virus. Access to water in everyone's home is essential to preventing the spread of the coronavirus because you need it to wash your hands and disinfect stuff. And the transmission of the current Omicron variant is now causing cases worse than we have ever experienced in the past. When the statewide moratorium on utility shutoffs was implemented last winter, we were hovering around an average of 100 new cases per day in Champaign County. Now this week, we are averaging over 800 cases per day. Last winter, Illinois was averaging 3,000 cases per day, Now we're averaging over 30,000 cases per day. Utilities are more important now than ever before, and it would be absolutely unacceptable to reject this resolution now. People have lost jobs due to the pandemic. Over 5,000 people in Champaign are currently at risk for eviction. So that means at least 5,000 people are currently being threatened with exclusion from basic utilities. And as Alan mentioned earlier, it is likely much worse than that because utility shutoffs tend to precede evictions. I want to emphasize a point that Eddie brought up earlier. COVID-19 continues to impact the health of Black and Hispanic people in Champaign at a disproportionately high rate, which magnifies the already unacceptable health disparities and inequities that they face. In addition to doing everything we can to prevent utility shutoffs locally, we should absolutely call on Governor Pritzker to enact a statewide moratorium on utility disconnections for non-payment. This moratorium should be without means testing because historically means-tested moratoria have allowed for thousands of households to be disconnected from their utilities, while non-means tested moratoria generally result in far fewer utility disconnections. So I urge the county board to put people's lives and health above the profits of the utility companies by approving this resolution and by doing everything we can to prevent utility shutoffs during the pandemic, both locally and throughout Illinois. Thank you.
Thank you. All right, Thomas Day. Can't hear you.
Can you hear me now?
Yes.
There we go. Sorry, I muted myself. So I'm a resident of Champaign County and a supporter of the resolution, as everyone else is. I don't have much more to add that hasn't already been said, just that we have an opportunity here to support some of our most vulnerable residents. And I think this is a perfect opportunity for you all to continue your service to the people of Champaign. And I hope you all heartily endorse the proposal. So thank you.
Thank you. Kendra Wade.
Hi, can you hear me?
Yes.
Okay. My name is Kendra Wade, and the decrease in pandemic safety decreases my clientele. Remember when we first locked down and people begged to open back up so they could do things like get their hair and nails done, get a massage? Well, I'm a licensed massage therapist, and I can tell you that having no protections in place during this pandemic only hurts my business. You'll have a full day booked and you're ready to make money, only to find that 3 out of your 5 clients for the day had to cancel, whether they just started to feel achy that morning or their kid had close contact at school and now the whole family has to quarantine. If I get a close contact and have to quarantine, I make no money. I'm an independent contractor. I have no vacation pay, no sick pay. I don't get PPP loans. I go without income. All of that has happened to me and my business partners. In just the last 2 weeks, one of them had a client test positive, so her and her whole family had to quarantine. The other, her son got a close contact at school. Whole family had to quarantine. 2 out of 3 therapists out now. Let's hope we can make enough money to keep the doors open. We have no protections in place, and because of this, I am suffering economically. I'm behind on my bills. While the utility companies have been profiting this entire time, I scramble to make rent at the end of the month as my client base dries up. This resolution is common sense and will help to flatten the curve so people like me can afford to pay their bills and make their rent. Thank you.
Thank you. Next, we have Dat Lu.
Hello, can you hear me?
Yes.
My name is, as you've heard, Dat Lu. I'm a student at the University of Illinois at Urbana-Champaign. I wanted to call in to support the resolution placing utility shutoffs as a pandemic safety risk. There has been numerous studies done by the CDC itself, by universities like Duke University that have demonstrated that utility protections reduces deaths in every measure, reduces cases in every measure. And if the people who are in position to pass this resolution do so, they will be playing a part in reducing deaths, reducing the severity of this pandemic, saving lives straight up. There's no question about it. So I beg you, please play your part as public servants to serve the public and end this cycle, help end this pandemic. That is all.
Thank you. Rose?
Hi, my name is Rose, and I just want to first off by listing a number. 839,000 Americans lay dead as a result of this pandemic, making this the most disastrous event in all 245 years of our history, even more deadlier than the disastrous Civil War. And this resolution would help make sure that less people die, and by doing so, help lessen the damage to the economy, help lessen trauma to people and grieving. To not pass this resolution would be condemning people to death, and that is neither moral nor American. So I beg you, please pass this resolution.
Thank you. All right, and if you've already spoken, please lower your hands. Michael Stevens.
Hi, can you hear me?
Yes.
Hi, my name is Michael Stevens, and I'm here in support of the campaign to stop utility shutoffs. I don't have much to say that others haven't already said. COVID is still an ongoing threat, and passing this resolution is just the right thing to do. So I'm calling on you to vote in favor of it. Thank you.
Thank you. Next, we have Ben Theobald.
Hi, can you hear me?
Yes.
Hi, my name is Ben Theobald. I am a resident of Urbana. I've been about a resident now for a little over 5 years. I'm, like many others, requesting the support of the resolution placing utility shutoffs as a pandemic safety risk. Given with what's been happening with the Omicron variant, we have had roughly a 7-day average here in Illinois of over 30,000 COVID cases. And I believe yesterday was about over 70,000. Things have gotten so bad that Governor J.B. Pritzker has urged medical facilities to postpone non-emergency services with this amid the Omicron surge. I would just like to kind of give you somewhat of a timeline. I'll try not to take too much time. Last year on April 5th, Governor J.B. Pritzker said that he would only be using vaccines as the only way to combat a surge in cases. A week later, April 12, 2021, the city of Urbana passed a utility shutoffs resolution. A week later, April 19th, the city of Bloomington passed a utility shutoffs resolution. And then, and keep in mind, this is 2021, just on April 22nd, Pritzker announced $80 million in automatic utility assistance. On May 11th, the Peoria City Council passed a utility shutoffs resolution. On May 17th, Governor Pritzker announced an increase to $115 million in automatic utility assistance. That automatic utility, unfortunately, that automatic utility assistance program expired at the end of June with $3 million remaining. And then, unfortunately, in that mid-July of 2021, COVID cases increased. And since roughly then we've had a 7-day average of 2,000 cases a day since August 3rd, and which was that's about 5 months ago. So we've had the University of Illinois Urbana-Champaign, Illinois student government body pass 3 resolutions on utility protections. We've had the city of Urbana pass 2 resolutions, and now we're hoping that the Champaign County Board will pass, which I believe would be one of the biggest government bodies to pass a resolution like this. Now we did have LIHEAP, which lower income heating energy assistance program. Unfortunately, last year 60,000 fewer households received that in the first season of the pandemic than the most recent. And I believe since between July and November, we've had roughly, I believe, 180,000 utility shutoffs. Now, I just want to make clear, water shutoffs pose a real threat to human health because the lack of adequate sanitation. Diseases are able to spread, and since COVID-19 is essentially, they say it's like the flu, but obviously it's been more deadly, as we've had over 800,000 deaths in this country. And what do you when you're sick with the flu, or in this case when you're sick with COVID, what are you generally told to do? Drink more fluids. And if you have your water shut off, you don't have a source of water. And given that the board of Champaign County Board of Health has recommended passing this resolution on utility protections posing a pandemic safety risk, I think that it is definitely what needs to be done. I'll also like to point out that I talked to a woman on WEFT radio. Some of you have been on that show called Where We Are At. And this was, I believe, if you care about the interview, this was January 4th, 2021 in our archive. Essentially, this was a young single woman who was pregnant and also had 1-year-old, and that poses obviously not having your water shut offs. That could be dangerous, and if you're a parent, because child services can come and deem that as a reason to take away your children. So given all of that, what has been said, and given all of the data and all of the statements that have been said today, I think what needs to be, it's no doubt what needs to be done, which is we need to pass this resolution if we want to have any hope or of chance of combating this COVID-19 pandemic. Thank you.
Thank you. Marina Manetti. And you can unmute yourself now.
Thank you. Can you hear me?
Yes.
When I heard about this,
I'm sorry, we can't hear you.
can you hear me now?
Yeah, I can hear you now.
Okay. When I heard about this resolution happening this evening, I too have never spoken at any such meeting. But with the experience of COVID in my family, COVID in my family, I personally can vouch for the fact of extreme despair and stress levels that COVID and Omicron are causing to all citizens of this country. I've lost my father, my aged father, My sister is also a frontline worker whose whole family got COVID. And I am taking care of my aged mother and am very worried of her state of health. I think that our government so far has demonstrated itself terrifically unresponsive to its citizens. And I think that unless you want escalation of the sort that happened last January, last year, all kinds of policies should be put in place to protect us from this onslaught. And this resolution is the least that needs to be done. To not pass it is criminal. Thank you.
Thank you. We have Nicholas.
Hi, thanks. I'm Nicholas Schemmel, member of the public. I wanted to make a short comment here, and I apologize for not having a stronger contribution to make. I only found out about this a few hours ago. So at the heart of the utility shutoff issue, in addition to what everyone has already been saying about the necessity for just bare survival, it's not an issue of will people pay their utilities, but can people pay? As others pointed out, over 2 years have passed and we've not seen anything other than contradictory policies being trumpeted from federal and state level. And now that's just completely left alone by the federal level. And we've all been buffeted by that confusion. So the question of can people pay? People will pay utilities if they can. But it's that big if there, right? So we have this opportunity to protect, the citizens that we have responsibility over, especially in a time where shutting down those utilities, and not to mention just straight up evicting, means freezing for a lot of these people. It can mean death in a lot of cases, and it can mean injury. So that's posing an additional risk to the COVID factor. I would ask that, I'm basically asking that while all the other protections ending or starting to end or no promise of fulfillment, while this issue is still going on, while COVID is still rampaging and only getting more intense, right? Omicron might be less deadly, but it is far more infectious, and that tips it over the scale. With nothing really changed for those affected most severely, and with them still at the bottom of what feels like a well that we can't climb out of, we have an opportunity here to really rise above the failures that have been made over the past 2 years and the dangers that have just been left wide open, and to pass this resolution. So thank you.
Thank you. Rita Connerly.
Good evening. Can you hear me okay?
Yes.
Thank you. So my name is Rita Connerly. I'm a resident of Champaign, a lifelong resident. And I'm calling in support to voice my support of this resolution. I think we should call it a common sense resolution, as we know that utilities are essential. I don't want to take too much time. I think a lot has been said here tonight in support of this resolution. But my heart goes out to those who have been impacted, to those who have lost their lives. Myself, I have been impacted by COVID. I have had to take hours and lose pay at work. So I'm hoping that you guys understand the severity of this pandemic, and by not supporting it, as one of our commenters stated, it would be criminal. You will have more people die. And I don't think any of you want to have blood on your hands. Additionally, I would ask that you apply pressure at the state level and the federal level, mandating a statewide moratorium. We need to support our most vulnerable citizens. And I'm hoping that you too will take a stance of people over profits and vote yes. Thank you.
Thanks. Emiliano? You can speak now if you just unmute.
Oh, sorry about that. Hear me now? Yeah?
Yeah, I can hear you.
Okay, cool. All right, my name is Emiliano Vera. I am a Democratic Precinct Committee person from McDonough County, and I will be reading a letter from a disability rights activist who has spoken on disability and housing issues in front of Congress. So I will read their letter now. Dear members of the Champaign County Board, my name is David Zoltan, and as a housing policy expert here in Illinois, I have fought for housing justice in communities around the state, in Springfield, as well as in DC, and of course, in my home of Chicago. I am also formally unhoused and a person with multiple disabilities who is forced by our inadequate systems in this country and this state to live in severe poverty, unable to work, caught in between the barriers against people with disabilities in place in the workforce, as well as for fear of the loss of the Medicare and Medicaid supports that keep me alive. I, therefore, devote the overwhelming bulk of my time that is not devoted to maintaining my health and well-being to doing all I can to ensure that no one need suffer as I did unhoused. Yet, even I, as a housing expert, can find the housing systems and supports in our state to be daunting and sometimes even impossible to navigate alone. It is not uncommon for there to be lapses in various supports or too much emphasis on keeping out bad actors, that the people like myself that need the help fall through many of the cracks in that system. For example, just this Monday, December 6th, I received a disconnection notice from ComEd. That notice had been issued on November 23rd, and it was for disconnection on or after December 3rd. I had somewhat ironically already applied for LIHEAP assistance the past weekend, but this was my second time attempting to do so. The folks at the program administering LIHEAP in Chicago had failed to respond to the first attempt from months ago, and here I was still seeking help. We know that losing one's utilities carries severe consequences. In weather like we have currently, people die from a loss of heat, electricity, and the things that electricity enables for our health, like keeping medicines at the proper temperature in my case. In a pandemic, that safety is even more important, as we see in the correlated spikes in caseload every time the utility shutoff moratorium has been allowed to lapse here in Illinois. The National Bureau for Economic Research did a preliminary study, in fact, of pandemic data and concluded that the utility shutoff moratorium prevented 7.4% of deaths in states that had upheld them by comparing data from state to state. I believe in a government for the people, one that cares for its people. A government that doesn't protect its people, from harm, including allowing its most marginalized citizens to be threatened with institutional violence, be it in the form of losing one's utilities or any other, has no legitimacy and is ultimately corrupted from its purpose. As such, I call upon you today to endorse and call for your congressional representatives to pass HR 4979, the Maintain Access to Essential Services Act of 2021, a bill that can help bring greater measure of security to the homes of so many that need our help. I remain at your disposal for further consultation or questioning at any time on this or other housing matters. I hope you will join me in fighting for the human right to housing that every person in Champaign County and across the world must be able to enjoy indelibly. A better world is possible. Sincerely, David Zoltan, Chicago, Illinois.
Thank you. All right, Sarah Holder.
Hi, can you hear me?
Yes.
Okay. I am a Champaign resident, and I am speaking in support of the resolution declaring utility shutoffs to be a pandemic safety risk. I am an essential worker in the healthcare sector. I see over 100 customers and patients daily, very close contact, and I'm also immunocompromised. I have multiple health issues that put me at higher risk for severe disease or death if I were to catch COVID. I take all the precautions I can, but at work I can't social distance and I can't work from home. I also live paycheck to paycheck, and if I were to have to quarantine, the lack of guaranteed income would make a huge impact on my ability to pay my bills. And people like me should not have to worry about choosing between protecting their health and the health of my coworkers or their coworkers and having the essentials to live. Like you can't recover from a pandemic when you don't have any water. How are you supposed to wash your hands? How are you supposed to drink fluids? Yeah, so I just speaking in support of that. Thank you.
Thank you. Justin Michael Hendricks.
Greetings and Happy New Year to you all. My name is Justin Michael Hendricks, CU resident, Creator Hidden Homeboy, educational policy major. I call and support the resolution as in 2021, a National Bureau of Economic Research case study reveals that disconnections for non-payments are 4 times higher for customers who are Black and Latino in all zip codes, including Illinois. Customers in these zip codes are 2 to 3 times more likely to be on deferred payment plans and 70% more likely to participate in low-income assistance programs for utility and housing. For each of these outcomes, there is a strong disproportionate burden on minority communities. Let's continue to showcase community culture and care, especially during the times of COVID, and once we overcome it. As an educator, it's very important that health and safety is always intact, from community to schools to families. Lastly, let's apply pressure on our officials, especially at the state level, to stop the utility shutoffs and even evictions. Thank you.
Thank you. All right, next I have, looks like a phone number. It's a 217-305 number. Oh, sorry, I should probably let you talk first. You can unmute.
Hello.
Hi.
Hi, this is Sarah Nixon. I'm phoning in because I too would like to comment briefly in support of agenda item 7.c, resolution declaring utility disconnections in Illinois to be a pandemic safety risk. At a time when the American government at all levels is proclaiming public health to be top priority, to not pass this resolution would amount to an act of public endangerment. Extraordinary and extreme restrictions and shutdowns imposed by the government, ostensibly in the name of COVID, ostensibly to protect our collective health and well-being, are costing people their jobs, and with that their income, and with that the ability to pay mortgages, rent, and utility bills. As one commenter mentioned, people are living paycheck to paycheck, and there are many more that are living paycheck to not paycheck, no paycheck. We are in the middle of January. To even consider not passing this resolution to protect people from the cold would be a truly dangerous act of governmental negligence. So please pass this resolution, and thank you for your time.
Thank you. All right, Michael.
Hello, I'm Michael Brunn. Can you hear me?
Yes.
Yes. I've been in town most of the time since 1963 and probably old enough to be responsible for most of the problems of the world in the meantime. I think that a lot of people have made a perfectly good case for why there needs to be protection against shutoffs. Nobody's addressed the situation facing the utility companies. And what I would say is that the utility companies have much more access to be able to lobby legislatures and others in order to change their business model if need be. Because I think that this crisis, and as it gets longer, it might not just be a crisis, but a condition, reveals that a lot of people aren't going to be able to make adequate use of utilities because they're not being paid enough, or because their jobs are not regular enough, or for whatever other reason. And therefore, it may be that the business model that's currently used, where you have fee for service, isn't going to be sufficient and will need to be modified. I think a resolution by the City Council is a good way to point everybody in that direction. And I can see the utility companies will eventually, if the pressure is sufficient, will be in a position to push legislatures in turn to change the business model by which they operate. I can imagine lots of different business models that might be different and that would be more useful, but I think that would lead us too far astray. My point is that the utility companies do need to get paid, and we need to have a way to think of that, how that can happen without people doing without what they need. Thank you very much.
Thank you. I have Kyle Fleming.
Hi, can you hear me?
Yes.
Thank you. My name is Kyle Fleming. I'm a resident of Champaign, and I'm speaking in favor of this amendment resolution. And as I'm listening tonight, I realize that my comments are going to reflect a lot of what other people have said. So I hope that anyone listening will consider these comments to be an amplification of things that people have already said, and I've tried to identify people who have made some great points in favor of this as best as I could. This COVID-19 pandemic is and will continue to be a universally traumatic and a mass disabling event that affects, and the virus itself affects not only our respiratory systems, but also our circulatory systems and our brain chemistry and neurologic systems. My personal experience with COVID has not been a diagnosis of myself, but have been diagnoses and cases among friends of mine, one of whom had such a severe neurological damage that she actually lost the ability to speak and walk for several months. So I think it's just crucial, everything that people have been saying tonight, for why we need to have these utility shutoffs and need to advocate for them and need to put pressure on state government and even federal and local government to do anything that we can to support these people and to relieve the pressures of surviving a deadly pandemic, not only with our health, but with finances, with community and social support. Ideally, this includes a number of direct financial assistance steps, universal basic income maybe being one of those steps. But since that cannot happen without a broad national and local support, one thing that we can do that will have an immediate effect is a moratorium on utility shutoffs. Alex Taylor mentioned a lot of great sanitation and hygiene reasons for this. If we want people to be safe, if we want them to have safe locations to quarantine, to take care of themselves, to feel better, they need to be able to be housed, and they need to have access to these utilities. And as Eddie Pratt Jr. and Justin Hendricks mentioned earlier, a lot of these utility shutoffs will disproportionately affect Black people, indigenous people, and people of color, as well as disabled people who maybe don't have the financial resources or access to necessary funds and services to be able to stay in their homes and have access to heat and water and electricity. I believe it's crucial that we support the most vulnerable among us, and to keep in mind that we are all temporarily abled, and that even a mild case of COVID-19 can have long-term health and neurological effects that will just create a much greater need for services and moratoriums and policy decisions like this. So I hope the Champaign County Board will support this resolution. I appreciate you allowing me the time to speak. Thank you very much.
Thank you. Next, Matt.
Hello, can you hear me?
Yes.
Hi, yeah, I'm Matt. I'm speaking as a member of the Bloomington Normal CPUSA Club, which includes our ever-growing and expanding Champaign-Urbana unit. And I'd just like to say that, you know, the data concerning the pandemic and how utility shutoffs exacerbate sickness and death are all there. They're easily accessible, put in charts and graphs that anyone can understand. But what's harder to trace is the economic effects due to this pandemic, which are allowed for by existing exploitative structures and government failures themselves. People taking time off work because they're sick, taking time off to care for sick friends and loved ones, caring for kids, even the loss of job or cut hours can snowball into hardships beyond anyone's immediate ability to mitigate and repair. Now, something else that's not really looked at as far as utility shutoffs are concerned is that they're oftentimes written into leases as a means for eviction, a cause for eviction. And they can even threaten to split up families via child protective services and the such. Then we look at these utility companies and they're not hurting at all. In fact, utility companies have continued to rake in obnoxious profits on what should be basic human rights. That's why I'm definitely urging you to pass the resolution so that this county board can call on Congress to pass the Maintaining Access to Essential Services Act, HR 4979 S1783, and to put some pressure on Governor Pritzker to use the authorization of 20 ILCS 3305 Section 712 to enact mandatory moratorium on utility disconnections without any means testing or crap like that, and to restore accounts that have already been disconnected. That never should have happened. It needs to be fixed. Now, it says a lot that some of the Democrats among you are somehow against this. I got to say, if there was ever a time when you could and should show an active interest in the basic well-being of the people in your communities, instead of kissing J.B. Pritzker's capitalist class interest-only kind of ass for your own political ambitions, that time is right now, here, tonight. Thank you.
All right, next speaker, Kyle.
Hi, yeah, can you hear me?
Yes.
Perfect. So, as a frontline worker who works with the most vulnerable right now, are going to be, you know, mothers and single mothers with children. I work in a WIC facility, and I fully believe that extending the shutoff moratorium would be very important because as is, these people are already vulnerable enough, and ensuring that they're able to get their basic needs met will ensure that they will have better health outcomes and will make sure that they overall just do better. I can't amplify any of this other information enough. I'm sure that every other person who has been speaking tonight has the same feelings I do, that this is unfounded what we are going through right now. And we need to make sure that everyone is protected and everyone is getting the right protections that they need. That is all I got.
Thank you. And Andrew.
Hello. Yes. Can everyone hear me?
Yes.
Okay, great. Hi, my name's Andrew DeFries. I live in Rock Island, Illinois, but I just want to comment on this because this is affecting the entire country, including Illinois. I was just going to comment on the same thing pretty much everyone's talking about tonight, about the moratorium for utility shutoffs and why that should be reinstated and a resolution should be passed here by the city council. I just want to say it is clearly a sign of that this is, been allowed to lapse. It's a sign of getting the country back to normal. And I don't mean that because it's actually returning to normal. I mean that because it's being brute forced into normalcy, right? We continue to have probably millions of cases, even though the last count was about 750,000 cases a day just from COVID here alone. But we have a shortage of tests. So we have that problem where we probably have millions of new COVID cases every day here in this country. On top of that, it's winter right now. It's still cold. We've had dramatic weather all year, but especially, in December going on to January. So I think it'd be immensely cruel to keep this happening where people's, power and water are shut off for no reason at all, other just because they can't afford to pay. And with higher inflation caused by exploitation of the capitalist class upon regular working class families, this is particularly egregious. It is brutal, it is torturous, it is cruel, and it's completely not unnecessary, especially now in a crisis. And you have to ask yourself, we allowed this to happen even before COVID. We decided to stop this during COVID, but now we're trying to restart the economy by everything going back to normal. And as other people have wisely mentioned, this is going to disproportionately affect Black, Brown, and Indigenous working families, disabled people, seniors, the list goes on. All the people that are the most vulnerable people in our society are going to be disproportionately affected by this. And that's immensely cruel. So I hope everyone here of their good conscience who has the power to do this, to protect working families, to protect the oppressed, the persecuted in our society, decides to do the right thing tonight. Thank you very much.
Thank you. It looks like that is our last public commenter. Seeing no more hands, we are moving on to communications. Are there any board members who have communications? Ms. Straub?
I would just like to say that I was really pleased to learn that See You at Home had opened their low barrier, no barrier winter shelter. And it's just wonderful to know that folks have an option. And I'm just really grateful to this body for approving some of the funding for that. Thank you.
Is there anybody else? Mr. McGuire?
Thank you. As people know, Martin Luther King's birthday is coming up, and there'll be a lot of different functions to be part of coming up over the weekend or the week. Thank you.
Thanks. Is there anybody else for board communications? All right, next on the agenda is Policy, Personnel, and Appointments Committee. Dr. Storr, take it away.
Thank you, Chairman Patterson. Let's see. The monthly HR report on file, as is the county clerk monthly and semi-annual report. There's a number of vacancies in county government, especially court service officer and correctional officers. And I encourage people to let their constituents know about these openings. Next item would be number 7C, considering a resolution declaring utility disconnections in Illinois to be a pandemic safety risk. Let's see. want to get that up here on my screen. Do we have a motion to approve the resolution?
So move Colbert.
Second.
Okay, approved by, motion by Cowart, and second by, who did the second?
It was Jacob Paul.
Jacob Paul. Thank you, Jacob. Is there discussion to the motion, discussion to the resolution?
Colbert. I'll
Miss-
be voting yes. I'll be voting yes for this resolution because I know the impact it's going to have on people. I know that every month since November, my bill been going up $100. So I could barely pay it, but I pay it because I don't want to get shut out. So I know the ones that don't have income coming in or working part-time jobs, this is going to be a burden for them to keep up with their utilities.
Thank you, Ms. Cowart. I know that we have, I asked some people from the Regional Planning Commission to attend and talk about the LIHEAP program to clarify some misinformation that might be out there about the availability for funds in support of people paying their utility bills. Is Ms. Dawn Rear in the audience?
Yeah, Chris, they're probably under my name because I sent them my link.
Thank you.
I'm here.
Thank you.
This is Dawn.
Ms. Rear, would you please tell us about the LIHEAP program? And I think I kind of asked a few questions and maybe you could address those, please.
Okay, the LIHEAP program is a program that assists households with both their gas and electric and propane bills. The program serves those individuals who meet the 200% of poverty or less income eligibility. And it also serves households that have the utilities in their name. I'll address the questions that you sent today. The first question you had asked about how many are denied LIHEAP benefits in Champaign County. And I'll address program year 21 and our current program year. In program year 21, 813 households were denied LIHEAP benefits out of 6,019 households that applied for benefits. That's a percentage of about 13.5 of that total amount were denied. Currently in program year 2022, we've served 4,047 households, and of that, 3.4% have been denied.
How many, excuse me for interrupting, but about how many households would that have been by number? You had it in your email. I think the number you had was 138.
Yes, currently this year to date, that's between September 1 and the current date, 138 have been denied. Some of the reasons folks can be denied, there's a myriad of reasons. They can be denied because they didn't return required documentation, or the utility bill is not in a member of the household's name, or their income exceeds the 200% of poverty, or they may have already applied this year and have met their amount that they can receive in benefits each program year. Your third question asked about, can LIHEAP prevent utility shutoffs? And yes, it can. Folks can come in and apply currently now through May 31st. If they need assistance just because they're behind, or if they are in a position that they are going to be shut off. So they can apply to try to maintain power or restore power. Sometimes folks come in and unfortunately, because they've already received their benefit this program year, we aren't able to assist them. But at that point, we do refer them to other helping sources within Champaign County to see if maybe they can be assisted that way. I think your next question addressed how soon someone can receive assistance to their bill. If they come in and apply and all of their documents are in a row and their application is complete, that pledge will be made that day to their utility vendor. The last question you asked about, do we have other utility helping sources in Champaign County? We do. We have a water program that assists with water and wastewater.
Ms. Rear, thank you very kindly for bringing that information to the county board in regard to this. I know that there are some charities, Empty Tomb is one, and some churches have helped people with bills. Usually it's medical prescriptions, but might also be for this. Are there any other, Ms. Michaels? Ms. Michaels?
Yes, sir. Thank you. Just a question. I know maybe in years past, I don't know how this year is reflecting your budget, but at some point, I know that LIHEAP has had to cut off helping people because they ran out of funds. And to me, one of the things that hit me with Ms. Rear's comments were that kind of like the veterans, if they had assistance one year, they cannot get another assistance until after like a 12-month period. Unfortunately, we're kind of in a unique situation that that might be difficult for some. So I didn't know how their funding was looking.
Well, the way our program is the program runs from September 1 through May 31st. Folks are eligible to come in for two benefits. Direct vendor payment, which when they come in the first time, that's usually the benefit that they receive. And then they can come in another time if they receive a disconnect notice, which is called reconnection assistance. Sometimes folks come in and the first time they come in, they're already in disconnect status and they receive all of their benefit that time. Unfortunately, that's how the program works, and I have to follow their guidelines and their policy and procedures.
Thank you.
Mr. McGuire.
Can I let the other Darlene Clopel go in case it might be Delitzo?
Sure.
No, it's the real Darlene Kleppel.
Okay, either way.
Okay, well, I'll tell you what, Jim, you're first in my queue. Why don't, please go ahead.
Okay, I will. And I just wanted to thank you, Chris, for asking these questions so we can have a clearer understanding of the programs that are available for assistance, both power and water. I think we should focus more on Champaign County and what we can serve people with. There are always limited funds. These funds are means tested, so they'll cover more people, not only these programs, but other social programs that we might support families with. We haven't in the past past resolutions like this, asking a government agency to do something that we obviously may be doing well because of additional funds. And so I won't support this resolution. I will support the programs and have in the past. I'm sorry to hear the stories, COVID issues and family issues people are having. But I think we're addressing the issue locally. Thank you.
Thank you. Ms. Kleppel, or County Executive Kleppel.
Yeah, so I just wanted to mention to the board, as you know, when you did your ARPA allocations for the first tranche that we got, one of the things that you allocated was some funding for utility assistance. And primarily, we were talking at that time about water and sewer. Sewer is what we've gotten a request from the CU Sanitary District. And that will be brought to the board to tell you what we've worked out in terms of negotiation at your next full board meeting next week. So just letting you know that you do have, we were thinking or somewhere in the neighborhood of $150,000 to $175,000 for that. And we've been able to work out a plan with them. So I just wanted you to know that's coming and that is something the board has already allocated.
Thank you very much for calling that to our attention. Mr. Wayne Williams, please.
I can't support this resolution as it's written. I believe in the idea of the resolution, but I believe it's lacking in some areas. I would like to give a few examples. A utility disconnect moratorium, which I support 100%. To pass a resolution like this and not also address an eviction moratorium, I believe is incomplete. This resolution mentions the Delta variant of COVID. And, I think that if we're going to pass something like this, we should use up-to-date information. We should talk about how the Omicron variant is ravaging through our community. There are several statistics in this resolution that are dated, not wrong, but dated. One thing that I would like to see in there is, so we're in Region 6, which is a region of 16 counties. And right now today, we have 24 ICU beds. 24 ICU beds for a region that includes Livingston, Iroquois, Ford, McLean, Champaign, Vermilion, DeWitt, Piatt, Macon, Moultrie, Shelby, Douglas, Coles, Cumberland, Vermilion, Edgar, and Clark counties. 24 beds it does not seem like a lot. And that statistic scares me to death. So I would like to see this resolution also address in the statistical section the lack of ICU beds in Region 6. Lastly, it talks about a moratorium on utility disconnections. And I think it's a little incomplete. There are a lot of people in this county that heat their homes with propane. And I would love to see, and I'll be the first to admit, I don't know what the answer is, but there are a lot of people that heat their homes with propane. And this resolution does not address that. So if we're gonna talk about utility disconnection, we're talking about heat, water, sanitary sewer, we should talk about everybody in the county and not just people who are able to heat their homes through electric or natural gas purposes. And propane, even in good times, gets so expensive in the winter, so expensive. And if you've never had to fill a propane tank or pay for propane, it is something else. I never have personally, but I know people. And so I can't support it as it is. So what I want to do is I want to move the table. If that fails, I'm going to vote against it. But not because I don't support the idea, but if we table, I would like to bring an updated resolution with more current statistics that addresses the whole of our community and not just part of our
Mr.
community.
Williams, I believe there's one in your, sorry to speak over you. I believe there's one in your inbox.
I saw your email, but I didn't see an attachment, Jacob.
I'll resend it right now. I'm sorry. I spoke with Mr. Store today and then went over that, and we rewrote it that that covers more people. It doesn't cover propane because I don't know how to just pay for that. I know as it's written, it doesn't cost Champaign County any money to do it as it's written. And then, it gives the local programs time to get the assistance to the people that need, or the people that need to gather the information to, if they don't get it done on the first time. I think just to table it or totally wait another, 2 weeks, months, 4 months, who knows, where people are still being cold is a cop out. And if we have opportunity to do action now, we can do it now. And then on the next go around, if you want to write one yourself for evictions and propane, that's also your right to do so. And we can add more because I think that would be a benefit. I'll send that updated email right now.
Well, and I would have no intention of waiting months. I mean, I think this is something we can get done pretty quickly. But just as it's written, I can't support it. So I moved the table.
Geez,
Do we need a second for that?
I think we do.
Then I'll second.
Oh, boy. Okay. All right. Discussion. I don't think that we have discussion on tabling of the motion.
Yeah,
I
you
think
do.
that you would do.
Yes.
No, a motion to table is not debatable.
Oh, gosh. Kyle, anybody remember Pius's?
Typically, we've had discussion on rules to table.
I won't oppose discussion, so.
Okay, well then let's go ahead with discussion. Dr. Furtado.
So my hand was up a while ago. So just to clarify and to sort of expound on a point that Darlene made, the amount of money that we put specifically into sort of household assistance was $450,000. And so, some folks have asked, and specifically in the conversation that we had, there was a very specific ask from the sewer folks because they needed some support. But there's nothing to say that we couldn't expand that to other areas for some of the kind of programs that, Chris was asking about. So if, for example, LIHEAP did run out of funds, we could always allocate some of our ARPA money toward that end if that's something that we so chose. And the question of tabling, I totally agree with Wayne that there's no debate that we need within our state and within our country to address the ways that the coronavirus has impacted vulnerable populations. But this, and I agreed with a lot of what the public said, but this resolution as it currently stands is somewhat outdated. But more so than that, I feel as if, there's just a lot of information in it, but it also kind of doesn't capture why I would support passing a resolution. And maybe I just missed it, but quite a few of and if so, I apologize. I tried to read it over again and I read it last night. A lot of the public speakers rightly stated that this pandemic has disproportionately impacted people along the lines of race and gender and income. And I don't know that this resolution actually says that. And I think as a body, it would be something that we would want it to say. That said, I don't know if tabling it is the right word. Typically what we do is we just move to put it on a new agenda or like forward it. And I don't think that this should take a very long time to rewrite. I think if Jacob has sent us a new version, we could use that as a jumping off point. And there's no reason that we shouldn't have it at the full board. So if we could, instead of tabling it, move it to the full board, that I would support. And I'd be glad to put energy into making sure that the draft is maybe pared down. I mean, there's a lot of interesting statistics in this, but I don't actually see how they make any sort of argument. And I actually think in some ways they detract from the final point, which is a call to action.
Thank you. Thank you, Stephanie. Eric?
Thank you, Dr. Storr. I'm going to echo Wayne and Stephanie. I think we should work on this resolution. I support it. I supported the letter. But the current form, and I haven't seen what Jacob Paul has sent to Wayne, needs work. As a person who lived on a propane tank for 20 years, I can also say that needs to be addressed. You always gamble in the fall. Do I get a contract? Do I buy it on spot? It always, with a string of cold days like we have now, you're watching that thing go down. You're wondering if you have enough money in your bank account to get them to come out and give you a half fill, and if they're even going to come and do it. We need to take care of the whole county, not just the county that's on piped in utilities and on the wire. This is the same as broadband. This is a thing that's a necessity. And just a correction, we have 26 ICU beds in Champaign County, Wayne, not 24. They're currently fully occupied at Carle Hospital. 100% of the people in the ICU beds are unvaccinated people with COVID. At the moment, they're using other rooms for other people. My daughter is in healthcare, and I get the updates every day, and it's not good. We need to address all of that. And I would love to see this come back next week in a better form. I also offer any help in the spare time that I have to help you guys get this into a really tight resolution. And I'd love to see this move on from there. Thank you.
Thank you, Eric. And I echo I hated to see the propane truck out in front of my house when we lived out in a rural area. Emily?
Great, thanks. I will not be voting to table this. In general, I think that the revisions are pedantic. It's a needless delay. But more I wanted to note on, I just kind of want to remind us of the goal of a resolution. It does not carry the force of law. It is there to start a conversation. It's by nature a statement of commitments and of values. Also, I just want to note, by next week, we will undoubtedly see stats of infection rates exponentially rise again. By the time that we sign it, or it will likely be outdated. It will be outdated. There could also be another variant that comes out in between the time that we sign it and when we draft it. I think this is fine as is, and I would not vote to table.
Thank you. Kyle Patterson.
Thanks, Chris. This is something that I absolutely support. On a very personal level, this is something that's very important to me. I work in an office that assists people and helps connect people to resources. And, every day I think about, utility shutoffs. As far as procedure, because I definitely share some of the concerns about the statistics. I think the most recent statistics on it are in July. So I think that stuff could be updated. And like Stephanie said, it's a little clustered. The bottom line right now is that this is, by almost every measurable aspect of the pandemic, we are at record highs. Whether we're talking about infection rates, hospitalization, Carle Hospital has more patients than it's ever had. But as far as procedure goes, I don't think we should table it, honestly. And it's important for the public to understand too, that this is a committee of the whole. So we will pass, hypothetically, we'll pass it tonight. And then next week at the county board is when we make it official. So what I would suggest as far as procedure is that for those who kind of share the same position as me that supported this idea, but want to see it rephrased, I think we should just pass it tonight. And then when it comes up at the county board, we can have an updated version to amend it to.
That sounds like a real good solution. Jacob, oh, wait a minute, wait. Samantha has not had a chance to speak. Samantha?
Yes, thank you, Dr. Storr. I'm just sitting here, just taking it all in. I do understand that some of the language is outdated, but it's definitely needed. We do need to set in place something as soon as possible. I think it's overdue that would ensure our most vulnerable population would not have to deal with the headaches of shutoffs. Also, I wanted to ask is if the lady is still here from LIHEAP, just to make sure that I have this right in my notes. So a person that has applied for LIHEAP assistance within 12 months will not be approved to receive additional help. I'm just thinking just the scenario. So our frontline workers in the beginning, some were laid off. And so then they maybe came to LIHEAP and got assistance. Well, then when they got back to work, maybe if they did catch the virus, well, then they're off again. And so then are you telling me that you would then deny them assistance because it's been within a year? If you can clarify that for me, please.
Certainly, I'll clarify that for you. So folks can come in typically twice a year. Once the first time they come in, they apply for their benefit. And most likely the first benefit, which is called the direct vendor benefit, will assist them and help them with their utility, and then they're taken care of. If they come in and then they're eligible to come in a second time, if they get into a situation where they're going to be disconnected or have an imminent disconnect notice, they can come in a second time. Sometimes folks come in the first time and they're already in that situation, and their first benefit is not enough to keep them connected or to restore their utilities, and they have to also use their second benefit. The program runs from September through May, so it doesn't really run a 12-month period. But the program does provide 2 benefits per household in that program year. Does that answer your question?
Yeah, but it still seems as if there is a chance that that person wouldn't get assistance that second time. You know, if their situation was in dire need the first time, then, we don't know what the forecast may bring 4 to 6 months later, then they could potentially be denied. Is that correct though?
They could be potentially denied if they utilized all of the benefit that was availed to them that first time.
Yeah. And so I would definitely support Dr. Furtado's suggestion to adding some of the ARPA funds with the LIHEAP funds, just so that, we've been through a year of hell, and everybody is on edge. And just the sense of, our frontline workers, that's who I'm keeping in mind, those that have been there from the beginning. And then, having the insecurity of not having employment, and then having the thought of maybe losing utilities, that's just not acceptable to me. So I will definitely be supporting moving this ordinance forward. Thank you.
Thank you, Ms. Carter. Since you brought it up, and I see that Dr. Dalitso Sulamoyo was present, is there a mechanism for us to supplement LIHEAP for using ARPA funds? And what would that, you know, between you and Ms. Rears, you're the brain trust here on that.
So what I will probably share with you is what I know statewide. In Illinois, we have two sources of funding to provide LAHEAP assistance. We have federal dollars, which I think most of the folks that spoke to the resolution referenced. But in Illinois, we also have state funds. And these are funds that are as a result of our regulated utilities charging a surcharge on their residential customers as well as on their commercial and industrial customers. Those funds supplement the federal funds because federal funding alone is not adequate to serve the entire eligible population in the state of Illinois that's eligible for LAHEAP. But even with those supplemental funds, we still are not able to serve the entire eligible population. So for instance, based on the 2020 numbers, throughout the state, I think we had about 1.3 million households that are eligible for LAHEAP. And collectively, I think all the agencies that provide LAHEAP services were able to serve, at least with the federal funds, about 189,000 of that population. And there are various reasons why we're not able to serve everyone. Part of it, in some years, we either run out of funds, and there, in some cases, we have counties where folks just will not, come to the agencies to seek assistance. But, this in the last couple of years, and Dawn, maybe you can correct me if I'm wrong, we've been fortunate to have other sources of funding that the federal government has appropriated. So we've had our regular LAHEAP federal funds, we've had our state funds, but then at the federal level, they also appropriated the CARES, through the CARES Act, there were additional LAHEAP funds that were appropriated through that statute. So we're working with multiple sources of funding right now to serve those that are eligible to receive services. But as Dawn pointed out, the program is not a 12-month program. And I believe one of the speakers that spoke earlier, last year, the state did indeed initiate a program where funds were directly remitted to the utilities to avoid shutoffs, and that was the UDAP program. So we have been working with multiple ways to serve our folks that are eligible. I'll end my comments by saying that I think you as the county board should know that our agency, or the RPC, has been one of the leading agencies in providing services, particularly during this very difficult time with the pandemic. These other agencies were trying to provide services remotely by offering folks to drop their documentation through drop boxes. Our staff started seeing individuals in person in July of 2020. And as a result of that, and as a result of Dawn and her team, we have been one of the leading agencies in terms of successfully taking applications and those applications translating into benefits being paid on behalf of those households. So Dawn, let me know if I've misstated anything in terms of the sources of funding we're working with currently.
Nope, that's correct. Thank you.
Thank you. Ready. I hope in view, do you have sufficient funds to meet current needs as far as you are aware?
We do. We have sufficient funds to meet the needs we feel at this time.
Okay. Thank you. And yeah, I'm making notes here. Okay. Uh,
One more
Jacob
question,
Paul-
Dr. Store. I'm sorry, one more question. Traditionally, does LIHEAP help with propane?
LIHEAP helps with propane, gas, and electric. Uh-huh.
Okay, great.
Oh.
Thank you.
Thank you, Ms. Carter. And, okay, Jacob Paul, please.
Thank you, Ms. Dawn. I did have a question. Would this resolution help you at the RPC? Would you view this as a benefit?
I can take that question. I mean, obviously, we don't want to see any of the folks that we serve disconnected, and it certainly would assist us in our efforts. Our goal at the RPC is to ensure that, you know, the health and safety of the families that we serve is at our utmost priority. One key thing to say, I think, too, is that the reason why we have the LIHEAP program is because folks that are eligible cannot afford to pay for their utilities. Most individuals that are at the income eligibility that we serve in LIHEAP are paying anywhere up to 30%, if not more, of their income towards their utilities. And that's why the LIHEAP program exists. So, you know, probably as you work through the resolution, those are some of the key factors I think that need to be taken into consideration. It's not the fact that even if we didn't have the pandemic, you know, those challenges have been in existence even prior to the pandemic. You know, the issue of energy or utility affordability is certainly a challenge for many of the households that we serve.
Thank you very much. And I would like to say the idea of where this conversation got at tabling it and wanting to move forward down the road of doing something later. The treasurer put forward a resolution earlier this year where we had the opportunity to help people. And I believe that that was something that we would get to later, and we have not. And I would hate to have an opportunity to help people again. And that the idea of potentially helping more people later and then not help anyone. So I would really encourage voting no to table and passing this resolution today.
I would like to withdraw my motion to table.
Thank you, Wayne. Ms. King?
I'm perfectly fine with that.
Okay, so the motion to table is no longer under consideration. Ms. Furtado.
You're muted, Stephanie.
Sorry, it's been a while. I would like to suggest that we move the motion forward until next month or until the full board with, and I forget at this point who actually moved the motion. If we could add the following, that we pass the motion, if they would take this as a friendly amendment with the understanding that we are going to bring an amended motion to the full board. If the folks who first and seconded this motion, that way we could get Jacob Paul's message or new language. We could put in some of the other information, for example, about why this matters in terms of race and gender, which I never think is pedantic. If we could do those two things, then if we would be able to say that, if we would be able to, whoever moved it, if they would say that that could be a friendly motion, I'd be glad to vote yes on this.
That would be Ms. Furtado. I mean, Ms. Cowart.
So Lorraine, is it okay with you if we pass it with the understanding that we're going to bring replacement text or updated text at the actual full board?
Yes, it would.
Okay.
Thank you. It was seconded by Jacob Paul. Is that agreeable?
Yes, thank you.
All right. Okay. That said, I think that would sound, Mr. McGuire.
So we're going to vote on something we have no idea what we're actually voting on. Because it
Actually,
wasn't
we
prepared.
do.
I'm sorry. I think I'm Dr.
Excuse
Stewart.
me, please continue.
We're going to move something to a full board meeting as unprepared. I don't understand that. Thank you.
It's kind of my sense from the discussion that that we're going to pass the resolution with the understanding that an amended resolution will be offered to be substituted for this one at the full board meeting on Thursday. And that this will be wordsmithed between now and then by a number of the board members who've stated an interest. Does that help, Jim?
Sorry, it doesn't change my comment. It's
Okay.
unprepared and not prepared for
Okay.
voting. Thank you.
Okay, all righty. I see no further, well, yes, we do. Ms. Kleppel.
I just wanted to mention, I think what you're looking for is you're postponing this motion to the next meeting, to the full
No.
board meeting. No,
No.
you're actually going to
No.
vote it up or down?
We're going to vote, as I understand it, from the sense, and correct me if I'm mistaken, we are going to vote on this motion with the intention of bringing an amended motion to be substituted for this one at the full board meeting on a week from Thursday.
Okay, so you're intending to vote on this motion as it stands tonight, yes or no?
Yes.
Yes.
Yes. Yes. And I think the rules allow us to do that. Okay, seeing no further discussion, Wayne, or I spoke too soon.
Only like before you vote, if Stephanie could just clarify what we're voting on.
Ms. Kloppel, Ms. Furtado?
I would just like to add the following sentence or the following phrase to the motion that was made by Lorraine, with the understanding that we intend to bring updated language to the full board.
Thank you.
Do you accept a friendly amendment, Ms. Cowart? Lorraine? Do you accept the friendly amendment?
Yes.
I heard yes. Mr. Paul?
Can you hear me?
I can hear you. I can hear you. Thank you. Jacob, do you?
Yes, thank you.
accept? Okay, very good. I hope that the recording clerk has all of that. And I ask the clerk to please call the roll.
Cowart,
Yes.
Esri,
No.
Furtado,
Yes.
Harper,
No.
King,
Yes.
Lakshan,
Yes.
McGuire,
No.
Michaels,
Yes.
Pesalakqua,
No.
Paul,
Yes.
Rodriguez,
Yes.
Storr,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Manatheranat,
Yes.
Williams,
Absolutely, yes.
Wolken,
No.
Carter,
Yes.
Patterson.
Yes.
It looks like the motion passes. The next item is other business. I don't see any. The chair doesn't have a report. We don't have any items to be placed on the consent agenda. Chairman Patterson, I am pleased to return the gavel to you.
All right, next on the agenda is finance. Dr. Furtado.
First up, we have a budget amendment 21-0064, Fund 080, General Corporate, Department 031, Circuit Court. Increased appropriations 15,000, increased revenue 26,479. And the reason is the increased revenue from AOIC COVID Rapid Relief and requests for additional expenditure. And there's an excellent memo that is in the packet. Do I have a motion?
So moved, Straub.
All right, so Straub and Lakshan, first and second. Discussion? Seeing none, if the clerk could call the roll.
Cowart,
Yes.
Esri,
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshan,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Manathernock,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
All right, next up, budget amendment 21-00065, Fund 080, General Corporate, Department 042, Coroner, increased appropriations 27,868, increased revenue 5,787 to cover increased autopsy toxicology and histology expenses, increased revenue from Northwestern University grant for toxicology expenses. Do I have a motion?
So moved, Esri.
Esri, I see Diane as a second.
Yes,
Um,
ma'am.
All right. Discussion? Seeing none, if the clerk could call the roll.
Cowart, Cowart,
Yes.
Esri,
Can you hear me?
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshan,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Sorry, yes.
Taylor,
Yes.
Thorsland,
Yes.
Manathernock,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
All right, next up, budget amendment 21-00066, Fund 080, General Corporate, Department 023, Recorder, increased appropriations 163,779, increased revenue 245,580. The increased real estate activity end of fiscal year 2021, generating additional revenue and requiring additional appropriation to some submit the state's portion of funding. Additional appropriation is needed in elected official line due to salary administration's miscalculation during the budget prep. $59, just a point of information, $59 is for that. The other $163,720 is the pass through to the state for that real estate transaction. Do I have a motion?
So move McGuire.
Mr. McGuire, do I have a second?
Second.
I'm sorry.
Sorry,
Mary.
Second, I'll second.
Okay, thanks, Mary. So first McGuire, second King. Discussion? Seeing none, if the clerk could call the roll.
Howard,
Yes.
Esri,
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshin,
Yes.
McGuire,
Yes. Yes.
Michaels,
Yes.
Pasalakwa,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Banner,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
All right, budget amendment 21-00068. Fund 627, Department 026, County Treasurer, increased appropriation 9,595, increased revenue 9,595. The increased revenue was due to non-redemption of interest for prior years of property tax CD. Just FYI, that was $3,395. And then the other 6,200 is increased revenue from sale taxes resulting in our tax sale, resulting in appropriation increase more than we had expected to earn. Do I have a motion?
Carter.
Carter first. Do I have a second?
Second, Williams.
Williams second. Discussion. Seeing none, if the clerk could please call the roll.
Howard,
Yes.
Esri,
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshin,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Pasalakwa,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Banner,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
All right, thank you. Budget amendment, BGA 22-3. And in case you're wondering why that's a new kind of budget amendment, that is, we are now on a new electronic system, so the numbers are coded differently. Fund 1080, Department 127, Veterans Assistance Commission, increased appropriation 5,150, increased revenue $0. Reasons received in, the donations were received in December 2021. So if we would like to be able to spend them, we, on Veterans Assistance this year, we need to appropriate them. And I would like to thank the two donors. One $500,000 donation was anonymous, and Mike Ingram donated $150. So thank you to both of those. Do I have a motion?
Michael's first, please.
Diane, do I have a second?
Carter, second.
All right, Carter, second. So Michael's first, Carter second. Discussion. Wayne, you have your hand up?
Yes, and I think he answered the question, but I want to be sure. And this also pertains to the next budget amendment. The documentation for the amendment looks different.
Yeah.
And so that's solely because of the new financial management system.
Right, so we have a new financial management system. Oh, so we have a new financial management system, and so this is the format in which it puts forward these resolutions. In my conversation that we had in Finance Agenda with Tammy, there is some conversation about working with the company to kind of adjust these in the future. But they're not going to look the exact same as the ones we got before. They also spit out numbers that are different. So that's the reason that those are different. Our financial management system, it starts with in fiscal year 22.
So the last budget amendments, because they were dealt with the last fiscal year, that's why those are the old format, whereas
Right.
these next two, okay.
That's right. Yep. Hey, it's less numbers I got to read. Any discussion? All right. If the clerk could please call the roll.
Howard,
Yes.
Esri,
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshan,
Yes.
McGuire,
Yes.
Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
Yes.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Bannock Theranot,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
Budget amendment BGA 2236 Fund 2630 Department 030 Circuit Clerk increased appropriation 68,000, increased revenue 0. Reason to re-encumber the fiscal year 2021 transfer for furnishings and carpeting. We made that just at the last meeting. And if anybody has a question, and Circuit Clerk McGrath is on the call. Mr. McGuire.
Madam Chair, I'd just like to recuse myself because the vendor is my spouse.
Thanks, Jim. I somehow guessed that one. Any other discussion or questions for Susan? I think she answered. Oh, yeah, sorry. I totally forgot. Esri, second. Who's second? Jenny?
I'll second.
Okay. Any other discussion? Okay, seeing none, if the clerk could call the roll.
Howard, Esri,
Yes.
Furtado,
Yes.
Harper,
Yes.
King,
Yes.
Lakshan,
Yes.
McGuire. Sorry, Michaels,
Yes.
Passalacqua,
Yes.
Paul,
Yes.
Rodriguez,
Yes.
Store,
I suppose.
Straub,
Yes.
Summers,
Yes.
Taylor,
Yes.
Thorsland,
Yes.
Bannock Theranot,
Yes.
Williams,
Yes.
Wolken,
Yes.
Carter,
Yes.
Patterson.
Yes.
All right, that's the last voting business that we have. We have reports from the treasurer, the auditor. We have 2 informational memos from the sheriff. Don't see anybody. Other business? Seeing none. By way of a chair's report, all I want to say is thank you to all of the finance staff and all of the staff up and down our operation who worked tirelessly to get this ERP rolled out. I think we've been on this odyssey for like 3 years. It's the equivalent of building a house while you're living in a house. It's a monumental amount of work. Everybody should, I know we're still working out some of the last things and everything like that, but you all should be commended for the hard work that you did. And with that, A 1, 2, 3, 4, 5, and 6 are for the consent agenda. Mr. Patterson.
All right, next on the agenda is Justice and Social Services. Chair Taylor.
Thank you. Item A, we have the monthly reports for probation and court services and public defender, as well as animal control. In your packets, there is a memo from the county executive. Item B, we have the Rosecrans Reentry Financial Report for November. We don't have anything under other business. Darlene, did you want to say something? You're muted.
I just was planning on introducing to the board tonight the new animal control director, and unfortunately she is on a computer that doesn't have audio, so she's not able to speak to you, but I will introduce her at the board meeting. Thank you.
Thank you, Executive Kleppel. I do not have a chair's report, and we do not have any items to be placed on the consent agenda. Back to you, Chair Patterson.
Thank you. Next agenda item is other business. We have a closed session. I would entertain a motion for closed session. If somebody has all the words to it. All right, Mr. Thorson.
I have those words, Mr. Patterson. I move that we adjourn this meeting and enter into executive session pursuant to 5 ILCS 120/2C5 to discuss the purchase or lease of real property for the use of the public body. I further move that the following individuals remain present: County Executive Darlene Clopel, Director of Finance Tammy Ogden, Facilities Director Dana Brenner, IT Manager Tim Breen, Executive Administrative Assistant Rita Kinklo, and Administrative Assistant Mary Ward.
Do you have a second?
Second. Not second.
I heard Esri first for the second. I guess there wouldn't be discussion. Clerk, can we have a roll call?
Cowart. 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 Okay, I'll come back to her. Esri.
Yes.
Furtado.
Yes.
Harper.
Yes.
King.
Yes.
Lakshan.
Yes.
McGuire.
Yes.
Michaels.
Yes.
Pasalakwa.
Yes.
Paul.
Yes.
Rodriguez.
Yes.
Store.
Yes.
Straub.
Yes.
Summers.
Yes.
Taylor.
Yes.
Thorsland.
Yes.
Vanek Thernot.
Yes.
Williams.
Yes.
Wilkin.
Yes.
Carter.
Yes.
Patterson.
Yes.
Okay, we'll go back. Lorraine Cowart.
Said yes, Mary.
All right.
Please,
All right.
Mr. Chair, can we take a 3-minute break?
Yes.
I think I heard Diane request a 3-minute break. Let's make it a 5-minute break. So
Kyle,
you
if you
guys-
call the meeting, if you call this meeting closed, then we can adjourn this meeting and say it will be adjourned right after the closed session. People won't have to wait to the end to come back.
yeah, that's how the motion was drafted. So this this motion is adjourning the meeting. But yeah, I think that I'm with Diane, that let's take 5 minutes and log in 8:50 to the second link. If you guys have that. Has everybody sent the second link?
Thank you.
If not, I'll let you know.